Good evening. Waiting for this to come on. Good evening. Good evening, everyone. Dr. Corrielus coming to you live from Philadelphia. It's Friday evening. I know this is the weekend in our time. So the weekend has officially started, but I wanted to come in live and get a chance, as customary, to touch on some health-related education prior to letting you go venture into the weekend, so you can take better care of your heart, not only for the weekend, but for the future to come. We want you to preserve your heart health. With that will come longevity, and so that you can spend your time enjoying what you like to do with your family and loved ones, without being held back with the ailment and some of the sufferings that come with heart disease and heart failure. Today is a special day. It's a Memorial Day. It's 9/11. Can't believe it's been almost 20 years. Almost 20 years since 9/11. Our heart goes out to those who were affected by this horrible day. I can remember vividly, I was just started practicing as an internist. I was in the clinic seeing patients, and while I was seeing the patient in the afternoon session, one of the patients had mentioned it on their way in, that there was something horrible happening in New York, and that was my first awareness of what was happening, and that's when I tuned in onto CNN, and that's when I found out what was happening. But certainly we want to give our heartfelt love to those who were affected on that day. As I'm waiting for folks to tune in and get to the site to join in. Hey, hello, Leslie Hubert, thank you for joining. Hey, Dr. Connie, thank you for joining this evening. Yes, indeed. Dr. Connie said it's hard to forget where you were on that day. Yes, absolutely. That is absolutely right. You cannot, there's no way of really forgetting that day. We'll always remember that day for sure. As we're getting ready to start, please share this with anyone on your circle. Again, and tag anyone as customary. Again, remember, sharing is caring. You have to, if you know anyone who can benefit from what we have to share this evening. This evening we're going to be talking about the effect of sugar on our heart. Last week we did talk about how salt, many ways that salt can affect our heart health. Today we're going to talk about sugar. Just to recap, the reason why we want to contain how much salt we are taking is because salt can have a devastating effect on the heart. Just like any other drugs that we take, we want to. Salt is another drug, and salt. When we think about salt, 40% of salt is sodium, 60% is chloride. The table salt, the salt that we consume in our food. That's what makes our food tasty. That's what preserves the food that we eat. A lot of times in the food industry, they use salt as a preservative to maintain or sustain or lengthen the shelf lives. So we want to be cognizant of how much salt we are taking in, because it can not only lead to hypertension, but also can lead to heart disease and heart attack that subsequently can develop into heart failure. And when we do suffer from heart failure, increased salt intake can lead to decompensation and increased mortality. People actually can die of increased salt intake from various salt-loaded food. So definitely you want to be cognizant of that and be aware and contain the amount of salt that you are taking in your food as a food intake. Today we're going to talk about sugar. How does sugar affect our heart? And so we'll touch on that. As you tuning in, please announce yourself on the chat. Just ask any questions that you have. We want this to be interactive as possible, so I can answer your questions, so I can really make it resonate to you as a listener, so we can make sure that as you walk away from here into your weekend, that you are able to apply some of those tips, some of those things that we'll be discussing. So we'll move ahead as customary. For those of you who are tuning in for the first time, I'm Dr. Sanul Corrielus, your board-certified cardiologist, CEO of Corrielus Cardiology, and national wellness speaker. Through my cardiology practice, I help professional men at the prime of their lives to live the best time of their lives and keep them from dying of heart disease. Heart disease is very prevalent in our community. So we need to be cognizant and aware of some of those things that we are doing that's keeping it in perpetuation. And so that's why we're here. That's what we do, That's why we empower you. We give you the education that you need to really raise your awareness, so you can choose heart healthy measures. If you know better, you will do better. If we know better, we certainly do better a lot of times. So we'll get into the discussion about sugar. The sugar that we consume, how does it affect our heart? Sugar, just like salt, are I think, what I call the two enemies to our health, to our better health, to our heart health. And so once we become aware of that, once we are aware of their effect on our health and how they affect our health, then we'll be more conscious about their use and at least contain how much of those that we consume, that we take in. This is not about cutting out salt or sugar. It's about really understanding how much we should be consuming and how they are affecting our health, our body. So in sugar, again, that's another way of really the food industry is really is able to do what the industry does, that is to sell food. To add sugar really brings out the taste. It connects with our taste buds, and once sweets or sugar is added, then there's really an enticement for us to really want to have it and have more of it, just like salt. So we need to be cognizant of that, and so be aware. Once we are in the awareness, then we can control. We have more control. Now we're in the driver's seat in terms of how much of the salt and the sugar that we are consuming. And so how does sugar affect, once we consume the sugar, how does it affect, does the sugar affect our heart? First and foremost, we normally, we're going to talk about in normal circumstances where we're able to metabolize the sugar. And then we'll talk about those who are not able to metabolize the sugar, such as those with diabetes. And there are two different types of diabetes. There's type 1 diabetes and there's type 2 diabetes. Type 1 is generally more congenital, more starts early, juvenile onset. And type 2 is more insulin resistance, is more adult, comes out more in later age.